Dengue fever is caused by the dengue virus and is generally regarded as a tropical disease as it's spread by various different types of mosquitoes normally found in the tropical regions of the planet. However, as the planet is warming, these mosquitoes are no longer purely restricted to the tropical regions, and the virus is spreading with the mosquitoes as they move to new areas which are now more suitable for mosquitoes to live in than they were before. Now, unlike malaria, which is limited to being transmitted by the Anopheles mosquito, since dengue can actually be carried by a wide variety of mosquitoes, directly attacking the vector of the disease, the mosquito, is unlikely to be able to actually stop the virus from spreading, though action in some areas may limit the spread of dengue. Now, the dengue virus can induce high temperature, vomiting, muscle and joint pain, but the most noticeable symptom is distinctive body rash, generally looking like the skin has been pricked by 1,000 needles. While the infection isn't usually too serious for healthy people, it can occasionally result in deaths, especially if the infected person is in a weakened state of health. Deaths often related to a sudden drop in blood pressure also relates to a more severe form of dengue fever called dengue haemorrhagic fever, where the virus causes a drastic drop in the number of platelets in your blood. The blood vessels become leaky, so the heart can't maintain adequate blood supply circulating around your body. This internal bleeding and low oxygen supply then can result in organ failure and possibly death. Cases of dengue hemorrhagic fever, though, are relatively rare, and most people who contract dengue recover within 3 weeks from being infected, with around 1 week of that actually feeling ill. Now, dengue fever has been a major issue in the developing world, especially in Africa, Central America and places like the Philippines, often restricting the development of those countries that have been impacted by the virus. But in general, dengue hasn't been considered a priority in the developed world. Most cases of citizens of the developed world only occurring in tourists or soldiers deployed overseas. However, as global warming is now beginning to impact global mosquito populations, cases of dengue fever are now becoming more common in southern Europe and many of the southern states of the United States of America. This increase in the number of cases has in turn stepped up research into new vaccines against dengue, and also better methods of tracking the infection to trace where local hotspots of outbreaks of dengue may be occurring. Tracking where and when someone has contracted dengue, though, is complicated by the delay between becoming infected and first symptoms starting to appear. There is currently a vaccine that has relatively recently been produced for dengue fever, but the vaccine has not yet passed regulatory approval in some countries, so it will depend on where you are as to whether you can currently get vaccinated for dengue. However, as the virus can't readily be spread from person to person, unless you're going to a country with a mosquito and a dengue problem, you shouldn't need the vaccine currently. If the planet continues to warm, though, the virus may become an even bigger issue to world health than the coronavirus was, and dengue may be the first of many diseases to actually break out of the tropics and become a major threat to the developed world. Getting a vaccine to enough people to totally eradicate the disease, the threat posed by dengue, is going to be unlikely if recent vaccination attempts are any kind of guide. However, unlike COVID, once an individual is actually given a vaccine, vaccines should confer immunity to the virus for up to 6 years, and there are currently more vaccines in the trial stages, so we shouldn't have to rely upon a single vaccine to deal with dengue fever.